My name is Candice Paterson and I work at in the Health Surveys Unit at the WA Department of Health. And I was so excited to hear about this conference, and thank you for inviting me to be part of the panel, because my primary role is to measure the patient experience. My primary role is to manage the Patient Evaluation of Health Services program within the Department of Health. So we call this program the PES program. And it's been running in WA Health since 1997 to measure patient experience and satisfaction with health services in WA. And it's had a lot of strong support from the health system over the past 20 years to maintain this program and to measure patient experience at a state level. So just to give you some background, the survey was developed based on a literature review, the Public Patients Charter, the Complaints Register, and in consultation with focus groups and with the Health Consumers Council of WA. So during those focus groups, they were identified 7 aspects of care that are considered to be most important to patients, and that formed the basis of the survey. This survey is governed by the WA Health Research Ethics Committee, as well as ongoing reference groups and consultation with our users, which include staff at the hospital sites and consumers. So the scope of this survey includes any public patient who's attended a WA hospital as a public patient. This includes, at the moment, over 75 hospitals across the state. As an acute care patient, this also includes public patients at Joondalup Health Campus, Peel Health Campus, and the recently opened St John of God Midland Public Hospital. And the spectrum goes from any patient who's attending a tiny little hospital in the wheat belt right up to a patient that's attending a brand new hospital like Fiona Stanley. So this program is considered an audit of activity as opposed to research. So we use random sampling to select patients from a variety of different consumer groups. This includes inpatients, such as adults, children and older adults, and maternity patients. We also look at outpatients and emergency department patients. We do the survey on a continual basis from year to year, and we do the reporting on a financial year basis. So the survey is done using computer-assisted telephone interview, also known as CATI, which has got an extremely high response rate, about 70% for the raw response rate, and our participation rates are really, really high, around 95%. Which just shows that the WA community is really happy to participate and give feedback and talk about their experience in hospital. So combined with the method of random sampling, it ensures that the responses are representative of the entire health system and not just of people who are particularly dissatisfied or satisfied with their service. So the survey is conducted at post-discharge. Patients are sent an approach letter that's been signed off by the Director General of Department of Health, and it invites them to participate in the survey. The interviews last for about 20 minutes, and patients are asked to rank several aspects of their care from those 7 domains, from most important to least important, and then answer a series of questions about their experience of their hospital stay and the service, satisfaction with the service that they received during their stay. They also have an opportunity to make a comment or suggestion, so it's not just about what we want to ask them, but also they have the opportunity to tell us what they want to say as well. In terms of reporting, the data is analysed at the end of the financial year and the reports are generated for distribution. So last year in 2014-15, me and my team generated about 177 reports. These are sent to individual hospital sites around the state as well as the health regions. The sites use these for accreditation and also to improve their, to inform their quality improvement and performance management cycles. We also send the report to the Chief Executive of each health service, the Director General of the Department of Health, and also the Minister for Health. And the results are also made publicly available on the internet site in the WA Health Annual Report. So you can access that information for yourselves if you would like. The data is also used in the WA Health Performance Management Framework. It's also reported to the Productivity Commission at a Commonwealth level. So in terms of results, we find that the results are pretty consistent over time and regularly show the areas with highest levels of satisfaction are also those areas that patients rate as being most important. Similarly, the areas with lower satisfaction are the areas that patients consider to be least important. For example, the time spent on your patient care and treatment and having personal as well as your clinical needs being met are the two aspects with the highest satisfaction are also rated as being the most important to patients. Whereas the residential aspects of the hospital are considered, have the lowest ratings in terms of satisfaction and are also rated being least important to patients. We also measure patient-rated outcomes, and this measurement shows that while patients are satisfied with their experience in the hospital, they're even more satisfied with the outcome of their visit. So these reports at the site level can be used to generate change, and I've got some examples of where some sites have implemented some strategies. For example, at Rockingham Hospital, they introduced a brochure that's given to patients at triage to inform them of how their emergency department works, because sometimes when you rock up the emergency department, you do not know what to do. Denmark Health Service now displays their patient-first brochures in the clinical areas. I could go on and on. I recently discovered that Geraldton Hospital have actually implemented a action plan to act on a lot of the areas that were falling below what they considered to be an acceptable level of satisfaction, and they fed that back to me, and it was really encouraging to see that this survey is being used in this way. And that's all I have to say.
Thank you very much.
No problems.